Hi, I'm Greg. I'm going to talk today about using the tools. This is called the Edge tool. We use the term Iastm, which is Instrument Assisted Soft Tissue Mobilization. With the tool, there are 4 different strokes that we use with the tool. 4 different purposes. So the first purpose is for pain, second purpose is for grit, third purpose is for prime, the fourth purpose is for inhibition, or for tone, if you will. So when we start, if you look at pain, it says very fast, both directions, very superficial, using the sharper edge. Grit also uses the sharper edge, fast but a little bit slower, and a little bit deeper. Typically only in one direction. Priming a muscle is to encourage a muscle. You're going to use the duller edge, shorter strokes in one direction, distal to proximal usually, and a little bit deeper than with grit. For inhibition or for tone, you're going to use nice, slow, long, typically progressively deeper strokes, also in one direction. And you're going to use the dull side. So when I go through, I'm going to reference pain, grit, priming, or inhibition, or tone. I'll use tone. So those, I have that posted up above the schedule in our break room. So I'm going to start with a little bit of lotion. Typically warm it up a little bit, just so it's not quite so shockingly cold to the patient. So I'm going to work lumbar here. This tool can be used everywhere. It doesn't have to be just lumbar. It can be done legs, calves, arms, neck, all of that. So when we first start, I put the lotion on. I tend to use the concave side first, and just nice, soft strokes. I'm just kind of scanning the area. You can also kind of use it to spread the lotion around. You're scanning the area, trying to find areas that you could feel. When you're working, if they're very painful, say this section is really painful, you're going to do nice short superficial both directions using that sharp edge both directions. And what that does is it's affecting mechanoreceptors in the skin and just giving it input so that the pain tends to diminish. Almost kind of numbing the area a little bit. Not fully numb, but it just gives enough input to the mechanoreceptors that it will calm down. For grit, you're going to go in one direction and a little bit deeper. I don't feel any grit on him right now, but the stroke would be very much like one direction. So you can do kind of quick short strokes in one direction. Again, using that sharper side. If I feel tone, I'm going to flip it over to the beveled side, the dull side. I'm going to use that nice, slow, long strokes, usually right along the paraspinals, coming all the way down right into the lumbosacral junction. Nice, slow, deep strokes. Feels pretty comfortable, right?
A little bit.
What are you feeling?
It's a little sensitive right there.
Okay.
It's not too bad.
So if it's a little sensitive, I can flip it over, do a little bit right in here in the middle. So I can do a little bit more of that. The pain stroke. Just to kind of desensitize the area. It helps those tissues to not be quite so sensitive. Okay. One thing you do want to be aware of wherever you are, the bony prominences. So spine is right here in the center. You have the iliac crest coming up. So I don't want to poke into those because they hurt. Right, scapula up here. I don't want to be running over the bone. That's not very comfortable. What I do tend to do is put my fingers right along the spine. So you know where it is. You're just running right along the spine. Okay. If you're going to work way down close to the iliac crest, okay, you can go both directions. You can pull it. You can use a broad handle. Is it feeling okay?
Mm-hmm.
How's that sensitivity?
Better.
Good. Okay. Not feeling any major knots on that side. It was a little sensitive, but I'm not feeling a lot of tone. You can use it with your hands. Same kind of stroke that you had with the hands. You can put the hand underneath just to guide it. You can follow right along the iliac crest and get those quadratus lumborum. Just follow the iliac crest. You can follow the lower rib cage. Just follow along. Again, you can pull towards. So you can lead with your fingers to know where the bone is. Haven't really worked this side yet. You can use a smaller angle if you're getting right up next to bony prominences. Just follow right along the bone. Again, we're trying to work the soft tissue, not trying to work the bone itself, so. Right along the spine. You can use the flat side if you want. Usually more comfortable is the concave side. It's just a more comfortable stroke for the patient. But to get deeper, you're going to want the convex side. So we have a little bit shallower concave and a little bit sharper convex if we need to, depending on what area of the body we're working on, what muscles we're working on. So typically if I'm working in the hands, I'm going to be using the smaller edge. I can get in deep. I can get into different muscles in deep. Really work in the thenar, hyperthenar eminence areas. Wouldn't really be all that useful along the spine unless you're trying to get right along the spine. Which doesn't happen very often. So I usually use the broader ones on the back. The flat one's kind of the halfway in between. You're still getting kind of deep, but it's still pretty comfortable for the patient. I'm not feeling a whole lot of tone. You do redden up a little bit. Maybe it's because I don't have a lot of lotion on you anymore. You okay? Okay, so the 4 different strokes. I didn't really cover the prime. The priming, say for instance, if they have shoulder winging and you want to encourage the muscles, you're going to be doing a prime. Hit those rhomboids and you're just kind of short, little, deep, not quite as deep as for tone, but deeper strokes, really to kind of prime that muscle, really encourage that muscle to start activating. Really work those muscles. So you can do pull strokes, you can do push strokes, whatever is comfortable for your hand in whatever body position you're at, or body position you're working on. Those will work really good. Okay, now I'm going to move to cupping. I think we're pretty familiar with the cups. I really got used to the silicone cups, the softer ones, just for the main reason that we don't have to use the gun. If we're running over certain areas and it comes loose, it's really easy just to stick it back on. We can do twists. We can really get the tissue in. It's really good to use 2 at a time because then you can really get the tissue to move. If you lose suction, it's just really easy to get it right back on. This one I like as well. I think that these ones move a little bit better than this one. I don't have a lot of lotion on here, right? Okay. But you can use that to really pull the tissues apart. There's also a clock where you can just kind of go in different directions and really just moving the tissue around, trying to get it to relax, trying to get it to loosen up, trying to get it to behave. So if you're running up and down and you lose, just really quick, easy to readjust and put it back on, right? So that's the one thing I really love about the silicone. It's really easy to use and get back on. It's still got plenty of grip. There you go. So this is called TDM, tissue distraction with mobilization, or with movement. So I'm distracting the tissue, pulling the tissue up into the cup, and I'm moving it. So if you see TDM on the documentation, that's what this means. Working with the tissue, just really trying to get it to loosen up, let go of all of its tone. Another way that we can do it, again, with plastic cups that we're all used to. If you find an area, especially that's really has a lot of tone to it, just one pump, that's all you need. Just enough to get it to stay. You can do the clock kind of movements with this one too. It's okay if it moves a little bit, travels a little bit, that's fine. And then what we can have the patient do is come up onto all fours in quadruped position, and we can have him move. So I call this cupping with patient movement. You can go into arch sags, lift up, drop it down, lift up, drop it down. You can go into child's pose, drop back, get a nice stretch through the spine. And you can go emphasizing one side, really hitting that one side. Okay, and you can tell it already turns color pretty quick. Don't have to leave them on for very long. The typical duration for using the tool or for cups is anywhere from 90 seconds to about 5 minutes. We don't have to do much longer than that. We can change positions, we can do something else. You can get into cupping where TDM, like I was saying, tissue distraction with movement, that I was doing for a couple minutes, 3 minutes, something like that. Then put these on for another 3-4 minutes. Doesn't have to be a long time. We don't have to put them on and leave them on for 10 minutes and just leave them static. Let's get them moving. You can do the same kind of thing with the shoulders. Put cups on the shoulders, have them do scaption movements. I've seen people using it with a bike, things like that. So neck, you can do movements where you're doing the tool as well as them moving. So side bends, you're getting the tool in the upper trap, and you can do side bends with the tool moving. That's really good. I'm going to take these off. Nice and red. That'll go. The discoloration should only last about 2 days. The maximum, I've had it last on me up to 6 or 7 days, but if we're doing it short time frame, less than 5 minutes, it shouldn't last very long, a couple days. The goal is not to necessarily get the redness or the petechia hemorrhaging or the circular spots from the cups. The goal is to affect the tissue. If it does bruise, that's a side effect that can happen, but that shouldn't be our goal. So a lot of times I will find areas that are stiff, working on them, they do bruise, they do petechia. That's not the goal that I'm working on. I'm trying to loosen up the tissue. So that is pretty much what I learned in a nutshell. So if you have any questions, talk to me.